to the head of our department, Employee Services Agency, David Huebner.
Awesome. Thanks, Michelle, and thank you all for joining. I'll keep my remarks pretty short, but I just wanted to welcome you all to our 2026 Career Expo and Resource Fair. We have some awesome things lined up. If you haven't been outside already, there are a few dozen booths out there that are there. There's also headshots downstairs. And then obviously just encourage you to mix and mingle with the panelists here. And then we also have actually two other panels, one downstairs just broadly being run by the Employee Services Agency about the hiring process. And then we have another one by Custody Health in this room a little bit later. In addition to that, I just want to take the opportunity to also thank the team and Michelle and her team for organizing all of this, and to all of you for coming, and to the departments for joining us. And with that, the last thing I'll leave you with is, as you do walk around, I think the big thing that stands out to me when I'm in these expos is just the breadth of the county and how many different opportunities there are across the dozens of departments, the 2,000 different job classifications we have, and just encourage you to stop by the different booths to learn more about the different opportunities. And so thanks again for being here. Thanks to the team for organizing, and I'll hand off to Michelle and to our great panelists.
Thanks so much, David. And thank you all for joining us today at our 2026 Expo. I'm Michelle Quon. I am at our Employee Services Agency, which is our human resources department here in the county. So today's spotlight session is support roles in our county health system. And I have three wonderful panelists I'm going to introduce shortly. But before that, I wanted to do some housekeeping items. If you weren't aware, the bathrooms are down the hall to the right. If you can silence your cell phones, I know we all love to hear ringtones, but it does disrupt the session. So if you can silence those, that would be great. We're also recording today's session, so if you prefer not to be on camera, please let one of us know that we would like to take you off the camera. And then if you haven't used the sign-in prior to coming in, please make sure that you check in the front so that we know that you all attended and we can connect with you after. So without further ado, let me go ahead and introduce the panelists. We have about 50 minutes today. So if you can hold your questions at the end, I promise I will build enough time at the end for all of your questions that you have for them today. So I'll actually start with Dr. Tong. Dr. Tong is our Chief Experience Officer at Santa Clara Valley Medical Center. And I'll have you introduce yourself to everyone.
All right, thanks, Michelle. Welcome, everybody. Really excited to be here today and to get the opportunity to give you a glimpse of what it's like to work for the county. So, as Michelle said, I'm a physician by background. I actually started out in healthcare in high school. I became a certified nurse assistant, and I worked during college as a CNA in various nursing homes. Eventually ended up going to medical school, and then came out here to California when I did my residency at Stanford. During that time, you get to rotate through Valley Medical Center, and I knew the first time, literally my first day there, I felt like I've never really felt at home anywhere, and I feel at home in this place. And the day after I finished my training, I started my first job there as a hospital-based physician. Spent about 10 years doing that, and then over the next 10 years, have had various leadership roles within the Santa Clara Valley healthcare system. I do things that I never, ever would have imagined that I would get to do. That really picked up during COVID when I was asked to oversee all of the mass vaccination and mass testing sites throughout the county. So if you ever got a test at the drive-through fairgrounds site, or if you got your vaccine at one of those community locations, including Levi's Stadium, that was thousands of people that we joined together, and I sort of led them through that journey. And that is actually my favorite example of how when people joined the county, they thought they were going to have one job, but then new opportunities presented themselves. And I'll talk about that a little bit more as we go on today. I don't want my introduction to go too long, but I am sort of one of very many people who have found new opportunities they didn't even know existed during their journey here at the county.
Thank you so much. And then next we have Xanadu Garcia. She's a senior health services representative at the main campus. Can you please introduce yourself?
Good morning, everyone. My name is Xanadu Garcia. As Michelle mentioned, my title is a senior health representative. Basically, my department, because I'm also a credential trainer, we assist onboarding staff in learning how to use the EPIC or HealthLink system for registration and scheduling. We also oversee and work alongside other departments to make sure that every aspect of registration, from the demographics all the way to the coverage, is accurate for billing purposes. I've been with the county for about 15 years, started off in public health as a health office specialist, and within the year worked up to a health service representative, and then from there I was able to promote to a senior health representative and then credential trainer.
Thank you so much. And lastly, we have from our O'Connor Hospital, a nurse manager, Tracy Labasan.
Thank you. Hello, everyone. Myself as well started in healthcare as a nursing assistant, and then I became a registered nurse. Moved around in working in the education department, and then ended up as a manager. Been with county since 2019 when they acquired O'Connor Hospital. It's been a wonderful place to work. I work with a lot of different healthcare professionals, medical unit clerks, senior office specialists, health service assistants, which is what we call our nursing assistants, monitor technicians, and registered nurses. So we're a great team, and we love working at Santa Clara County. Thank you.
Thank you so much. So between our three panelists, there's a breadth of knowledge and experience at the health and hospital systems here at the county. And I'm sure you saw the title. It says support roles in the hospital. So what does that really mean, and what do those roles look like? So I wanted to start with you, Dr. Tong. In terms of the support roles at the hospitals, what are some of the key positions that keep things running every single day at the hospitals?
Sure. Well, I realized I probably should give a little overview of the entity that we call Santa Clara Valley Healthcare. So that includes our 4 hospitals: Valley Medical Center, O'Connor Hospital, Regional Medical Center, and St. Louis Regional Hospital. Then we also have a number, depends on how you count them, but somewhere between 15 and 20 outlying clinics spread throughout the county. And so our support staff work in all of those areas, as well as our custody health setting, which is our jail facilities where we provide health care. And the support staff roles vary a little bit depending on whether you're talking about a hospital setting or a clinic setting. I think that Tracy and Xanadu will go into detail as well, but I'll highlight one role that I think is, in my mind, just kind of an air traffic controller for the hospital inpatient units, and that's called the Medical Unit Clerk. The acronym is MUC, so we tend to call them MUCs. Not a very attractive title, but their role is so critical. They are like the glue that holds the unit together. They're the ones who answer the phone. You know, when a doctor gets a text or a page from a nurse and they're trying to call back and reach the nurse, the MUC is the one in the middle facilitating that conversation. They're the ones who may activate the operator to call a code blue when the nursing staff are needing that kind of support. They're the ones who just keep everything under control in the unit. A lot of people in that role have a background as in administrative work, secretaries, office specialists, and so they're very detailed and on top of things, great communicators, and enjoy the new challenge that comes along with working in acute care hospital space. So that is my favorite one to highlight. We also have roles such as our environmental service team who keep the place clean. That is actually extremely important to our patients, that when they're coming for healthcare, our facility is nice and clean. You don't want to go somewhere that does not look safe from a cleanliness perspective. And so that team is just critical for ensuring safe and pleasant care for our patients. Our dietary staff, when you're in the hospital, you want decent food to eat. It's part of your healing. And so I've actually worked a lot with our dietary kitchen team in trying to expand the plant-based meals that we offer, more climate-friendly foods. So every person plays a critical role within the hospital and clinic setting. But I'll turn it over to others to expand upon some other examples.
So I just want to point out one thing. There were a lot of roles that are support roles in the hospital that Dr. Tong covered. One of the key areas that she did cover that I don't know if you all caught was a transferable skill. She had said that for the monks, a lot of them had that experience as an admin assistant or maybe an office specialist somewhere else. So maybe you still can transition over to that similar type of support role before our hospitals as well. So we'll go into applications and all of that in a little bit later on, but I kind of wanted to talk about what's unique about the hospitals that we have in the county. We're not any hospital, but we're a hospital that services our community. So I actually wanted to go over to Tracy, and if you can shed some light on how do these support roles really differ as a community hospital that serves our community here in San Jose?
Yes, thank you. O'Connor Hospital is one of the smaller hospitals, not the smallest in our healthcare system. We like to consider ourselves a community hospital, serving the community around us. I mean, we all do that, but we like to consider ourselves, kind of the smaller hospital. And we have a service area around us that a lot of the patients are, age 65 and up. So recently we acquired our age-friendly designation at O'Connor Hospital. So that involves from pre-op all the way to being discharged out of the hospital. And so we've all received some extra education, and we're looking at designating ourselves to treating an elderly population with extra education. So that's something that we've recently done, and that was involving everyone at O'Connor. So from the medical unit clerks or the HSAs and the nurses and the transporters. So we're that's something that we've done that's recently new to just kind of keep ourselves standing out as a community-based hospital for the service area that we serve in the community.
So here's a question I'm sure everyone is curious about. What type of attributes really help someone thrive in these support roles, and what helps them kind of excel in their career or break into this maybe type of roles that you guys have kind of touched on that support our hospitals?
I believe that someone with empathy is going to thrive in our hospital system, especially because of the community that we service. We help service those who are unhoused, and then just looking at the different clinics and where they are located, because like it was mentioned, we serve all of Santa Clara County, so that includes from South County, which is Gilroy, all the way through Mountain View. So that's a huge area to cover, and there are various different cultures that we service. And so having empathy, understanding the different cultures that you will come in contact with and how to communicate, I think that is going to be something that is going to help you thrive within our hospital system.
I agree with everything that Xanadu said. Also a culture of teamwork. Every person in the healthcare team is essential, from, as Dr. Tong said, the environmental services who keep our hospital clean, but also materials management, which is our supply department. We couldn't survive without them, making sure we have all the essential equipment and supplies that are, current and up to date, that they go through, make sure they remove any expired supplies, order everything, keep our levels consistently replenished so that we have everything we need to take care of our patients. So that's another role that's very crucial. Just working well together in a team. For an example, if we have any patient crisis, everyone comes to the bedside to help. From the medical unit clerk, ready to call or get any orders. the pharmacy tech, the transporter ready to transport to a diagnostic area or to another unit, the nursing assistants, the nurses, the physicians, everyone is there, EKG techs. So it's definitely a group effort and a team effort, and we all jump in and are ready to help to make sure we have the best patient outcomes.
I would love to add to that to say flexibility. A quick story, when I was new with the county, in my first 2 years of being a doctor there, I remember exactly where I was standing when someone called me and said, Dr. Tong, would you be willing to be the person in charge of pressure ulcers, which the common word for that is like bed sores that people can unfortunately experience when they're in the hospital for a long time. And my first thought was, that does not sound like very much fun. But I said yes, and it allowed me to learn so much, to meet people I wouldn't have otherwise met, to learn how improvement efforts are done in the hospital to try to prevent things like that from happening. And it really led to a number of other opportunities to expand my skills and eventually to end up in a leadership position. So in retrospect, I'm so glad I said yes to something that didn't sound particularly exciting. And then years later, I mentioned before during COVID, when we had all of these sites out in the community, we actually had staff from across the county who came to support those sites. At one point, I had librarians, people from animal control, tax collectors, just all sorts of like plumbers and people who work for the county in other roles normally who were supporting the healthcare operations during the disaster of COVID. And at the end of that, some of them were so sad to leave that environment of direct service in the healthcare setting, and many of them actually eventually came and joined our hospital system. And so that to me is also just a county-wide opportunity in that setting of disaster, but also in non-disaster times, being flexible and not immediately having a I don't want to do that, or I don't want to have a change. Being flexible and open to change can really lead to new opportunities.
Thank you. And I hope everyone jotted down some of those characteristics and attributes that they talked about. This is what they're saying is really needed and essential and strong attributes that they would, really look for in potential candidates that are looking to be in these types of roles. But it's not about what attributes that the employee has, but you as candidates also, I would hope, want to think about what is it like to actually work in this hospital? What is the culture like? How is it like working in these hospitals and with the colleagues that I might potentially have in the future? So I'll start with Tracy. If you can kind of shed some light on what does it seem like to work at O'Connor Hospital, and what is the culture like?
Okay, well, that's a great question. Having worked at O'Connor Hospital under a different healthcare organization, and then having worked with Santa Clara County, I was pleasantly surprised and very happy to learn that we had the same cultures. A culture of compassion, unity, serving the community, and healthcare for all. So we had the same cultures, so that was really important. Working at O'Connor Hospital, I find that everyone really respects each other and has a sense of compassion and kindness. You'll walk down the hall, everyone will give eye contact, say hello, good morning, how are you? It's just a friendly place to work, and I think that makes a difference. You really enjoy going to work every day and working with everyone and just being a unified part of the healthcare team, which I think has really been something that's made me stay there. Instead of looking at other places, it's the culture that has kept me there, and you'll hear that from many people. And I know that I can attest that to myself and many colleagues that we've been there for many, many years. Some people are considered lifers. They start in the organization, they never leave because we're happy there. We might move to different roles. There's opportunities for education, education reimbursement, professional development reimbursement in all roles. So there's a lot of movement. I myself have started with, medical unit clerks who are now nurses, hospital service assistants who moved to a monitor tech role. So these are just examples that there are opportunities for growth and development. So yeah, I just think that the culture is one that is caring and compassionate and supportive.
Thanks so much. So it sounds like if you want to be a part of an organization that leads with compassion and supports the community, O'Connor might be exactly where you should look. And with that, I kind of wanted to expand on that question a little bit. It's not just about the colleagues we work with, but what about the population in which we serve? What is that culture like, and how does that impact your role in serving such a diverse community? So Xanadu, I'll start with you, if you can kind of shed some light on that.
So when I first started with the county, I was an office specialist. I worked for public health. And the department that I worked with at the time was for home health nurses who would go out and assist moms who had just had their babies released from the NICU. So that's one role where you get to learn, you get to meet, new moms and making sure that they have all of the resources that they need. From there, I moved into the clinics. I moved to East Valley Clinic, which is off of McKee Road. I'm not sure if you guys are aware of where that's located. And it's getting to know your community, making sure that you're able to communicate with them, kind of have the put on your listening ears, right? Because we all come from different walks of life. So you get to learn your patients, you get to become very friendly with them. So as they come into the clinic, they see you, and as they're walking in, they're already smiling because maybe they're having a bad day, and they see you and they're like, oh, they just come up to you, and you don't expect to build what I would call a bond with your patients or your clients, but that on occasion will happen, especially when you're there for, quite a long time, or these are regular patients that are coming to your clinic. So you get to know them, you get to see them grow. I had, while I was there, I worked in all of the different departments within East Valley Clinic, and my favorite was pediatrics, solely because I got to see the babies grow. Moms would bring them in as newborns, and throughout the years, I got to see one particular young man. By the time I left there, he was already 18, and I just couldn't believe, wow, I've seen you from the moment you were a baby through now graduating high school, So I think the culture, getting to know your community and building those bonds, even though when you go to work and you don't think that that's going to happen, but that's a great aspect of getting to know your community and building with them.
Thank you so much. For a personal story, I'd also like to share that the culture is so real in terms of them treating you like family once you're there. I had the fortunate experience of actually delivering at Santa Clara Valley Medical Center. My firstborn was a NICU baby, and he was there for almost 2 weeks at the NICU, and they have an amazing team, and you can tell that everyone genuinely really loved being there and helping you kind of navigate as you're also treading unknown waters and have so many questions. But they really show that they're there to support and really just excited to be there. So thank you so much for sharing that. We kind of touched on it a little bit, but we had heard a lot of stories about, I started here, then I ended up here, then I started getting training and I went over here. Can you shed some light on kind of what that growth opportunity and professional development really looks like at Santa Clara Valley Medical? Anyone?
For me, my experience has been great. Again, I started as an office specialist. It is administrative. Getting into the healthcare field, I've been in the healthcare field for quite some time. Initially, I thought that I was going to want to be more on the patient care side. I don't know when that changed, but it did. And while I know that that aspect is rewarding, I also find that being on the administration side is also rewarding. You know, being able to grow. As Tracy mentioned, there is education funds within the county that they allot, but the county itself has various different classes that they offer. Anything from, you know, how to use Excel spreadsheet to a class on getting you prepared if you want to move ahead, if you want to become a supervisor. So my recommendation is that you take advantage of all of those courses that the county has to offer. Maybe you don't think that it's going to benefit you, but if you attend those classes, not only are you attending for your own personal growth, but you're also getting the opportunity to network with other colleagues from various different departments. So I'm in education and systems training department. Maybe I go to the class and I meet someone from Parks and Recs. Maybe, you know, you don't know that you're interested in a specific department until you go to these classes, meet other colleagues, and get to know them. And that's a great way of building your network. You never know when you're going to possibly need assistance in having a question answered. It doesn't seem like maybe I'm not going to need it in this department, but somewhere along your journey, you're going to have a question that you don't have the answer to, and you're going to be like, oh, I know Susie from Parks and Recs. Let me reach out to her. So growth along with the education is also reaching, you know, taking the courses available within the county. I would highly recommend that.
I'll add a contrast to that. We also have people who started in a position and have literally been in that same position for decades because they love what they do so much. I'm thinking of one medical unit clerk at Valley Medical Center in particular, who she was there doing that job when I was pregnant with my first child and interacting with her at that time. That child is now 20 years old, and I just saw her the other day, and she's still right at that desk, you know, in charge of that unit, loving what she does. And so, while there are opportunities for growth and expansion for people who land in a spot that they really love, some people end up, you know, just thriving in such a position for many years.
Thank you so much. So we're at a Career Expo at the County of Santa Clara. I'm sure many of the questions here is, what does the application process look like? So I'll kind of go over that a little bit. I think one of the most unnerving things during the whole application process is, am I just not going to hear anything? And is it some AI cross-reference that's kind of vetting for keywords? Although the staff would love for that to be the case, it is not. It is actually individuals reading every single application that is submitted and looking at all the supplemental question answers that you have submitted, as well as any attachments per recruitment. So the applications are not rolled over to another posting. So please make sure that any posting that you see on our website, that you do apply to each one that you are interested in. So fun fact though, you don't have to start from the very beginning when you're applying. It actually carries over your work experience and background to your next application. The portion that you will have to answer are any of the supplemental questions that are added to that particular posting. The other question is, well, how would I know? I also didn't know when I applied to the county in 2016. Oh my goodness, it's almost 10 years ago now. I didn't know how it really worked. It was my first time applying to a public agency, and I didn't hear back. So I thought, that's it, I should just move on. So a lot of times on the posting, it will have deadlines or timelines in which the posting is closed. And if there's a written exam, it'll say the dates of the exam as well. More likely than not, you will not hear back from Human Resources until after those deadlines are completed. So if the posting says it's not going to close until May 10th, they will not reach out with any next steps until after May 10th. So I usually say, if you hear back immediately, it's usually one of those, sorry, we're not going to proceed with your application. If it takes a little bit longer, more likely than not, we're in the exam process and your application was continued on. If there's any time that you have a question on the application you submitted, definitely reach out to us. It's HR@ESA, and I'll actually have someone provide that information after, but reach out to the HR team and say, I applied to this role, I haven't heard back, could I get a status update? And we're more than happy to provide that. But a lot of times, maybe you're applying to 1 or 2 positions that you really, really love, or maybe you're applying to hundreds of applications. I feel like we've all kind of been there at one point in our lives. So what really helps your application stand out, and then what would help in terms of that process? The supplemental questions are really key. It really provides this insight of your story. Why are you applying for this role? What experiences do you have? Does it relate to the position that you're applying for? So that's an opportunity. People used to ask for cover letters a lot, or an introduction. That is your cover letter. You're telling us about yourselves and telling us why you are the candidate that we should move forward in terms of that recruitment. The public agency also is uniquely different than the private sector, I say, because the private sector, I think they post what their unicorn is. I'd love 20 years of experience doing exactly what I'm looking for, but they have some wiggle room in terms of who they continue on in the recruitment process. In the public sector, we have employment standards that are listed on our job descriptions. It's not a mystery. If it says you need 5 years of experience, of janitorial experience cleaning at the hospital, that's exactly what you'll need, exactly that 5 years of experience. So keep that in mind as you're looking at the postings, because employment standards are a bright line. If you have 4 years and 10 months of great experience and you don't have those 5 years, unfortunately, we will not proceed with your application. It has nothing to do with you being a great fit or a good candidate, but unfortunately, it is a hard requirement for our posting. So keep that in mind. I have a surprise question for all the panelists here, though. Let's say you have a great application and you're moved forward. I know one of the things that I question a lot is, well, how do I sell myself? Because I'm really great about talking about Susie next door, but what should I really highlight, and how should I really get prepared? Like, what do you look for to really be that standout candidate and really shine on how you would be a good fit for these roles?
Well, for me, because I've had so many different recruitment processes, for example, specialty training programs where you can get literally hundreds of candidates. So where everyone has the same education and certification. So I do look at the supplemental questions and see what they have beyond that, so I can narrow it down to to so many applications for interviews. I also look at if they have letters of recommendation. That's always helpful too. But I would just recommend make sure that you fill it out completely with all of your job experience, and answer each question completely, because when it comes down to it, we do as managers take a look at all of that, because we will have so many applicants at times. And then when you get to the interview panel, we do look for those that have good, that can demonstrate empathy and compassion, because we are in the healthcare environment. So I definitely look for that, as working in an inpatient clinical setting. And it just depends what specific role it is, because that is something that you'll see on the job specifications. But if there's something extra, say you've taken an extra coursework or something that might help you stand out as well. Because sometimes we do have so many candidates, because Santa Clara County, we are such a large healthcare company with clinics and hospitals. And I just want to say, serving the community is really something that I found very rewarding. As these others have mentioned, you meet people who come back and say, oh, I was born here, and now they're a patient. Or they say that I gave birth to my child here, as an example, and now you're taking care of them. Or you meet them out in the community, because Santa Clara County does so many community outreach events. My unit, we worked at the flea market. I'm sorry, we did booths at the flea market, volunteering. We've done some walks, cardiac, heart health walks, as an example, blood pressure events. So this has been great to meet members of the community, and sometimes they might be your neighbor or someone. So it's just very rewarding working in the community that you live in.
For us, being that we are considered frontline staff, we help with the registration, the scheduling. If you have previous experience with scheduling or maintaining a schedule, registering in other like in other hospitals, other clinics, if you have experience with the various different health coverages and what it entails and how it works, along with making sure that everything is accurate for a patient to get billed appropriately. Emphasizing that information. I've sat on panels where we see on paper that they have the experience, but sometimes our nerves get the best of us. I've had it happen to myself as well. You know, just remembering that you have the skills, you wrote it down on paper, making sure that you verbalize that. Toot your own horn. That's the main thing, right? Who's going to go out to bat for you when you're in front of a panel? No one but yourself. So making sure that you let us know all of the different areas of expertise that you have within what we're looking for when it comes to frontline staff. Also, if you've been recognized from other areas or other employers, you know, let us know. Sometimes we'll ask, what makes you stand out, or what, you know, how are you going to help us thrive in assisting our community? So any examples that you can provide of how you've accomplished something in a previous employment, that is also what we look for, because that lets us know that you you know, you have the capability to thrive within our hospital system, especially because we deal with all walks of life.
I agree with all of that. I'll just add, displaying during an interview that you know a little bit about what you're getting into, in terms of knowing a little bit about how our healthcare system is different from, say, a Good Sam or a Kaiser or a Stanford. The fact that we are part of a larger government entity, the fact that we serve everybody regardless of, you know, their insurance status, their ability to pay, and that we provide some really state-of-the-art services to the community, from trauma centers to, you know, spinal cord rehab. There's no need to become an expert on our system, but just doing a little bit of research. A lot's available online, or talking with people that you know who might work in our system. Just displaying a little bit of, you know, you don't mind being around people who are sick, that you've maybe spent some time in an environment where people are sick and anxious and maybe not feeling their normal selves for one reason or another, and that actually appeals to you, that you come with a spirit of service to others. Those are things that are hard to convey on an application, but come through much more clearly in an interview.
Thank you. I usually also wanted to add on, I think that a lot of times people do get nervous at the interviews. It's nerve-wracking. People are staring right at you, seeing if you have the right answer, and sometimes it can be 4 people that are looking right at you and you're sitting across from them and doing that. So in terms of helping with those nerves, I usually say sometimes practice makes perfect. And a lot of times the interview panels will have some standard questions, not saying that there won't be unique questions as well, but know what you have as your story. This is your opportunity to shed some light of what brought you there and why did you apply to that specific position. Definitely don't show up and say, I love having this opportunity interviewing with this is not Stanford Hospital. Definitely know who you're interviewing with, know a little bit of insight of the organization, but also know, why are you there? Why are you applying for that specific position? Definitely know what the position entails. You've heard some stories in terms of the attributes that they feel is a strong attribute that would make a candidate successful in these support roles. And keep that in mind as you're having this, I like to call it a conversation. It's an opportunity for you to get to know the panelists as well as the panelists to get to know you. So definitely know why you're there, why you applied for the position. And unlike any other hospital or healthcare industry that you may have applied for, what brought you to their door? And I think that's really important to remember. With that being said, I also kind of wanted to touch base of what shocked you or what surprised you, I guess, as kind of a community hospital, a community serving hospital. And I don't think I've heard it yet, but if you are all unaware, the county hospital is also a teaching hospital. So I was hoping that you can shed some light in terms of what makes that environment unique and surprised you as you started your journeys there.
I can start with that one. So I've actually left the county twice over the last 20 years, both times thinking that I have 3 kids and commute a long distance and thought I was going to something that was just going to be easier. And both times I ended up somewhere that I was shocked at how different it was from my experience here working in the county. And the differences really were another setting that I went to was actually also a public hospital, government owned and operated, but just in my mind, did not provide a high level of care. It's not somewhere that I would have wanted to take my children or my parents. And what I can say about our system here in this county is that we really provide outstanding care. And that it's somewhere that I would bring my own family, and I have brought my own family before. And that is what, just something that really stands out about us.
So at all of our facilities, we have hospitalists, which are physicians that work for Santa Clara County. And at O'Connor, I can speak for O'Connor that we do have community physicians as well. So it's been really professionally fulfilling and making the teamwork because of their accessibility. We have 24/7 physicians at the hospital. So this has really helped with the care for the patients, readily available, the communication. Quite frequently, you'll communicate, they'll come to the bedside, you'll get orders or assessment of the patient. So that has been really nice working with the hospitalists, the physicians at the hospital that work there. And then we're also teaching hospitals. So we have the Stanford Family Residency Program at O'Connor, and I know Valley has other colleges there as well, other medical schools. So they're there as well 24/7. So it's really nice that they're easily accessible. We can communicate very quickly through the computer, as an example, with secure communication chats. So that's really nice that they're readily available for our patients. And I think that's crucial in quick and expedient care for the patients. Also, I would consider us a cutting edge healthcare system. We have micro-robotics as an example for surgery. And we have a lot of programs that may not be offered at other hospitals. We have, I think, one of the top 100 neurovascular rehabilitation centers at Valley Medical Center. As an example.
Number 7 in the country.
Oh, number 7, wow. So that's just examples from the top of my head. Our surgery programs are exceptional. Our clinics, we have so many different types of clinics that we offer many different services to our community. We have a structural heart program, so just a lot of things. I know we have the gold certification for our stroke program, so there's just a lot of awards and recognitions. Our maternal, family, child health services have awards and recognitions, so we really are a top-notch healthcare system. So I do want to say that and just share that working for our healthcare system, you can definitely have a sense of pride that we are one of the best.
I'd have to agree. So I grew up here in San Jose. My mom worked for the county, and before I even graduated high school, she was encouraging me, come work for the county. But you also hear it's the county, you know, you're going to put up with a lot of horror stories. And so I was very hesitant. I'm not going to lie about that. So I went into the private sector, and I was just amazed in the difference from the private sector to working for the county in my colleagues and their compassion. So I feel that because we are the county and we do work with different people in different walks of life, I feel that the compassion within the county workers, it's different. It's there. So hearing the horror stories growing up to actually being in the environment and seeing, hey, that's not what it's really like, right? It gives a great sense of pride in knowing that we have that compassion to be able to help our patients, not only emotionally, but physically, you know, with their health and everything. So I've been really surprised at how compassionate a lot of our colleagues are, and also knowing that even being the county that we are, you know, we have advancements in our healthcare. So that was a huge eye-opener for me, but that also makes me proud to work for Santa Clara Hospital System.
Thank you so much. So we have a few minutes left, so I did want to open the floor to see if there were any questions. If you wanted to raise your hand. Okay, let me walk on over.
Okay, great. And then how do blue blazer in the back? Oh, yes.
Hi, my name is Kathy Tran. Thank you so much for sharing all your experience. It's been really nice to hear from you all and learn from you. I was born and raised in San Jose. In high school, like 10 years ago, I'm aging myself, but I interned with Supervisor Cindy Chavez and Betty Yung, so I'm a really proud member of the District 2 community. And I worked in tech for a little bit before deciding to transition into healthcare when my mom was sick, and it was just my first intro to healthcare, and it was just really nice to see how passionate everyone was. They made a really big impact on me and my family. And I just graduated from nursing school, and unfortunately, thank you. Unfortunately, like a lot of my peers, we've been really struggling to land our first role. A lot of us want to stay in the Bay, our family, our pride, like I said, for our community is here. So I would love to hear if you have any tips and advice on how to navigate that experience.
congratulations, first of all, and on your exciting career. I think you made a wonderful choice. I know that unfortunately sometimes the hiring comes in waves where sometimes we have so many positions and, you know, we're just doing tons of recruitment and job fairs and to fill all of our positions. And then sometimes, you know, we're kind of stable and we're just filling a few positions at a time. So it just kind of depends. I know personally from my unit, the retention, we don't have a lot of turnover, but I do, we've done specialty training programs, or if people retire or decide to transition to another role, then I'll have a vacancy. But I would definitely say continually keep looking at the scjobs.org website and continually just keep applying. So when a position does come up, you'll be able to get onto that candidate list. And then also continue to get any certifications that you can. You know, for nursing, get your, you know, NIH as an example. Make sure you have your ACLS, BLS current and all of that. There's also other opportunities where you might want to get into the county and then apply in advance later. So that's something as well that you can do. We've had a lot of nurses who took on support roles and then transitioned later to their nursing position after they've already been in county. So that's just something that they've done. But just definitely hang in there because it does definitely go in waves. I remember there was a time maybe 10 years ago, new grads were going out of state to get experience and then coming back to their hometown to look for something. And other times they were already getting positions immediately out of graduating. So it just really depends, but definitely hang in there. Santa Clara County employs thousands of people, so there's always usually something that comes up. So hopefully you'll get something soon. Good luck.
I just wanted to add to that a little bit as well. I think one of the things that's really tough yours is really loud, is really like, is anyone going to give me that break? Because everyone wants someone that already has the experience. How am I going to get that experience if no one gives me that experience, right? So I think one of the things that I would probably recommend is for your specific case, if you have a registered nursing license and you just graduated, our clinical nurse is what we call a registered nurses in the county. It's a clinical nurse 1 position is our entry-level clinical nurse series. So I would definitely keep a look at that. We have an HR booth outside and they'll be able to tell you a little bit more, but I think also maybe you're not starting where you thought you would start. So as a nurse, maybe you really, really want to work in the NICU, but they don't have many vacancies. So maybe you start out in the emergency room, which maybe is not everyone's first choice, but you know, maybe it's a department that has a higher attrition rate and you can kind of start out there. And it sounds like from everyone here, there's a lot of opportunity to move around and kind of grow and be exposed to different areas. So just keep that in mind. The other thing that the county has as well is temporary positions. Again, that's not ideal for everyone that's looking for a full-time coded position, but we actually just updated our merit system rules, which is our personnel rules that we abide by, in which internal positions or postings are open to our temporary employees as well. That's a huge step in terms of a different direction that the county has in terms of its hiring practices, which just changed this past year. So keep that in mind as maybe you apply for a temporary position. Again, not ideal, but it gives you the opportunity to apply for internal postings as well. Okay, and then there was a question up here.
Thanks for having this informative session. My name is Sanjeev. I work as a respiratory therapist for 33 years. I've seen a lot of changes, so I guess my profession is one of that it's always taken for granted until someone cannot breathe. So the question is, where does county see healthcare system itself come in 5 years, and why should I make county my employer opposed to private or other county?
I can speak to that. So, well, one thing I would say is if you just look at the trajectory of the county health system, it has gone up and up and up over the last 6 to 7 years. So by purchasing 3 new hospitals in the last 6 years, we only did that because we saw that the demand for our services was so high. I forget the exact numbers, but if you went somewhere like LA County, the percentage of people with Medi-Cal who are cared for by the actual county system is very low, single-digit numbers, because there are so many providers throughout the county who also will take Medi-Cal. Here in our county, the percentage is extremely high because there are so few other entities that will take Medi-Cal. So our Medi-Cal population is growing and growing. In addition, a lot of other private hospitals and private physicians are not so enthusiastic about taking patients on Medicare, and that population is definitely growing as the baby boomers age. More and more of those patients are coming to our county system, and so we are projecting additional growth of our patient population, which translates into additional growth of staffing needed to take care of that patient population. So really, at this point in time, there are no indicators that our system is shrinking or going away. There are a lot of, I would say, uncertainties in the world right now, what the next 10 years bring, but what we are certain about is that people will continue to need healthcare, and they'll continue to need public supports of that healthcare.
Wonderful. And unfortunately, we do need to cut questions right now, but if you still have any questions for our speakers, I believe they're going to be out at a table outside, or maybe you guys can meet outside of this room right now.
Yeah, there are a few booths outside for the different hospitals that we have in the county. In this room, the next session is going to be for our custody health and operations. So if you're interested in healthcare, but on the custody side, this is the place for you. So thank you so much, panelists, so much, and you all for being here.